There's a lot of factors, and it's definitely multifactorial, but at the end of the day, Americans aren't meeting dietary guidelines. 95% of Americans don't meet fiber intake guidelines, which is 25 to 38 grams of fiber per day. Fiber is incredibly important for a number of health outcomes, including a lot of chronic disease. 90% of Americans aren't meeting vegetable intake guidelines, which is 2 to 3 cups per day. 90%. Over 50% of Americans are eating more than the recommended amount of added sugar daily. On the activity side, 80% of Americans aren't meeting physical activity recommendations, which is 150 minutes of physical activity, moderate physical activity weekly. And Americans aren't even walking. The average American walks 3,000 to 4,000 steps per day. So they're not meeting dietary guidelines and they're not meeting physical activity guidelines. Why is that? A lot of it is cultural and a lot of it is policy based. Nearly 100 years ago in the 1930s, the US government started subsidizing crops, corn, wheat, and soy, in order to stabilize food prices and support farmers. And we still subsidize those crops today. And those are the basis for nearly all highly processed, nutrient devoid foods that Americans are consuming. So it's not that corn, wheat, and soy by themselves are bad. It's just that those are the basis for all of the hyper-satiating foods that are high in calories, high in sugar, and low in vitamins, minerals, fiber that Americans are consuming. And so those foods are very cheap for Americans to consume. And we call produce specialty crops. And those subsidies do not exist for produce. And so those foods are much more expensive. Combine that with the U.S. economic system that prioritizes profit-driven capitalism, encouraging food manufacturers to maximize profits by cutting costs, using cheap ingredients, accelerating production, and optimizing marketing to sell as much as possible. And so as a result, we've created this food environment that makes it inaccessible for many people to eat what we would consider a healthful dietary pattern. Food insecurity is also a big issue in this country. Somewhere between 10 and 15% of U.S. households experience food insecurity, meaning they don't always know where their next meal is coming from, or they don't always have access to the food that is needed to meet their nutritional needs. There's something called the stroke belt in the southern United States, which is where the highest number of strokes occur, and that is also highly correlated with a number of other chronic health conditions, including hypertension and diabetes, and that's also highly correlated with poverty. So again, you have a system where people don't have access to nutrient-dense food, and because of financial reasons, aren't able to eat in a dietary pattern that we would consider a healthful dietary pattern. This is also highly correlated to healthcare access. In the United States, we don't have a universal healthcare system like every other industrialized country in the world, and so many people are left without healthcare coverage. And if they do have coverage, a lot of times that's disastrous care, not preventive care. And so we have food deserts in this country, but we also have healthcare deserts, which are areas in the United States where people don't always have access to the healthcare that they need. And that can be because of a lack of facilities, because of a lack of healthcare experts or healthcare practitioners, because of lack of transportation, sometimes language or cultural barriers. And so they don't have access to the healthcare that they are requiring. That's strongly tied to increases in preventable diseases and a major problem in our country as well. Any of these things play into something called social determinants of health, which are these factors that directly impact our health. And those are things like economic stability, healthcare access, educational access, something called the built environment, which is kind of the environment around you, the roads, the bridges, the parks, things that increase walkability, and also social and community support. So all of these factors and all of the policies that directly affect these factors have a direct impact on the health of Americans.